to another installment of Chiropractors Ironing and Telling Awesome Stories. I'm going to tell you a story now that I've told many, many times at our patient orientation class and other talks on chiropractic that I've given, not just here, but in Europe as well. One of the greatest success stories I had early on in practice was with a young girl who was brought in who was having ear infections basically constantly. She was 20 months old and she had had 16 months of ear infections, 16 months of antibiotics, and tubes put in her ears, and the problem had not stopped. This kid was infected all the time, and she needed help. And someone told her mom that chiropractic may be able to help her. Now, the mom didn't know why, and I had to make it very clear at the beginning of this child's care that chiropractic is not the treatment for ear infections. It has nothing to do with the treatment of ear infections. What we do as chiropractors is we identify what's called vertebral subluxation. Vertebral subluxation is a misalignment of the joints, bones, and tissues in and around the spine that lead to nerve compromise, which leads to poor regulation of the brain over whatever those nerves go to. So the brain communicates down through the spinal cord, out through the nerves. And if there's any decrease in communication, things don't work properly. Now, you may or may not know this, but birth is a fairly traumatic experience to the baby as well as the mom at times. And any child that is born with assistance or forceps, or let's say over 90% is what the statistic is, over 90% of the kids born with some kind of assistance have some sort of, and that's forceps, suction, the like. Over 90% have some sort of upper cervical spine damage. So we were looking, because this child had been delivered with suction, we were looking for some kind of vertebral subluxation issue in the neck. Now again, remember, this kid had ear infections basically her entire life. 16 months of antibiotics, basically zero relief from these infections. We identified problems in her neck. We adjusted her one time with a soft pediatric chiropractic adjustment, which is very different, incidentally, than what we would use with an adult. It's very gentle and very safe, especially at the hands of someone who's been trained in pediatric chiropractic, like myself. Told the mom to bring the child back the next week, and they did. Now, the only thing that they had not tried at this point was chiropractic. Remember, tubes in the ears, antibiotics like crazy. She was in the middle of an ear infection that after that first adjustment went away, but she was also on antibiotics. Now, there had not been more than a few days in the past 16 months where she did not have an ear infection. A week goes by, no ear infection. 2 weeks goes by, no ear infection. 3 weeks go by, no ear infection. For the first time in 16 months, after 2 to 3 adjustments at my office, the child was no longer having ear infections. In this time, the child was exposed and did get a cold that normally would have manifested itself as an ear infection once it sunk in. Didn't happen. The kid's ear infections were gone. To my knowledge, after that first series of adjustments, the child never had an ear infection again. Chiropractic isn't a cure or treatment for ear infections. It is a correction of dysfunction that may make the child vulnerable to ear infections, may make the child not heal from ear infections. But it's not a cure, but it is effective. Thanks for watching.